What do I do?
We can't diagnose him while he screams.
Better than killing him with painkillers that...
That was quite odd, and also I'm not sure how long it takes for that medication to take effect, but quite odd. Hi everyone, welcome back to the channel. For those of you who are new here, my name is Darren, and I just finished my 4th year of med school at Monash University here in Melbourne, Australia. Next year I will be completing an honours or a BMed Sci year before finishing my final year of medical school, and I think I'll go a bit into that decision in a future video. In today's video, I will be watching a clip from the popular medical series House, and I actually stumbled upon this clip while I was preparing for my exams, and in the start I realized that he is teaching a group of medical students or doctors, I think, and he's asking them questions as well. So I thought this would be an interesting video to react to and share my thoughts about what I think might be going on as he teaches them. So my first reaction video, I hope you guys enjoy, and let's jump into it.
3 guys walk into a clinic. Their legs hurt. What's wrong with them?
When someone's leg hurts, there can be a lot of reasons for this. Ones that come to mind are intermittent claudication. So as people age or have particular diets or lifestyles, cholesterol can build up in all the arteries of the body. One of those places is in the calves, and for these people, when they walk for longer distances and exercise, they can develop pain in their calves. And another cause would be deep vein thrombosis, which can lead to the life-threatening complication of a pulmonary embolus. Otherwise, I think musculoskeletal or physical pain is pretty likely as well, especially in the general population.
What were they doing when pain presented?
I have no idea.
You didn't ask? You didn't take a history?
Of course. But all that told us was what they said happened.
Yeah, that's why when you go to the doctors, they ask a lot of questions, especially if you ever have students as well. When we first learn the history, we're very thorough with everything. So how long has it been going on for? How bad is it? Rated out of 10? What does it feel like? What makes it better? What makes it worse? What do you think might have happened? There's a lot of very thorough questions, and that's what's meant by a history. So let's see what House gives us about the different patients.
Person A, farmer, says he was fixing a fence. Tightness in the ankle, loss of muscle control.
Usually in medical school questions, when they give you information, it's because it points towards the diagnosis. Particularly in exam questions, they give you the most classic case, and every piece of information they give you is usually related to the answer. So if an exam question was a farmer who twisted his ankle while mending a fence, that points really strongly towards physical injury, in my opinion.
Person B, volleyball practice. Coach figured it was a pulled muscle.
That one also looks like physical pain, so we'll see how the story plays out.
In less than 2 hours, one of these 3 will be tossed out of the hospital because they were faking it to score narcotics, and one will be very close to death. Any guesses on which is which?
I quite like how this illustrates the breadth, because at the start, everything seems pretty similar, right? You have leg pain, and then you sort of unpack the story more. And now he's told us the end story, which is one person was faking it, one person was close to death. I'm not sure. If the stories are true, I would guess maybe the golfing one is the one where that person became quite ill, because of the fact that it seems less likely to cause injury than the other 2. Whereas the other 2, I can see how mending a fence and playing volleyball you could hurt yourself. And also it seems to be weird they would stop in the middle of golf to go to the hospital, but...
What should we do first?
Family history?
Indicative of leg pain, that's a very short list. Any history of bone cancer, osteogenesis imperfecta, or multiple myeloma?
Yeah, that's also why doctors, apart from asking you everything about why you came here, they ask a lot about your past medical history, your family history, because some diseases are more likely to happen and may predispose you to certain illnesses as well.
Could be a blood issue. We should run a CBC and a D-dimer.
And get an MRI.
MRI or a PET scan?
I think these are quite excessive tests to order to start off with, because they haven't really talked to the patient or examined him yet at this point.
Puncture.
And the usual order for when medical students and doctors see patients is history, so asking you all about why you came in, your past medical history, family history, allergies, all of that, and then exam, where they'll look at you and then they'll send off blood tests as well. And from my experience, they stick to that structure pretty rigidly. So even if someone is really unwell and you're like, oh, surely I just send off the blood test, or surely I just treat them already, unless it's pain, usually or it's very certain what's going on, usually they still go through all the steps here. So that's why they wanted to examine that person's leg before sending off the test. And with her, I think examining it showed a pretty obvious cause.
You have tendinitis.
How old is this person? I mean, it's not really a 40-year-old man on the girls' volleyball team, right?
It's a leg. Leg is a leg is a leg.
Well, I was just worried that...
Did you worry about her more if she was younger?
Demographic is actually fairly important, especially for medical school questions that can lean you towards one answer or the other. Because like I said, medical schools typically give you the most classic examples of diseases because they want to drill in the basics. And so whether a person's older or younger, male or female, what background medical issues they might have, those are quite important actually. So changing the situation from a 40-year-old guy to a pretty young lady for an exam question would change the possibilities of what's happening a bit as well.
I need to know everything about you.
I went back 3 generations, no history of cancer, Parkinson's, or any other degenerative condition. But there's this boy at school, and he's on the boys' volleyball team, and they made out at a party, and now he won't call her back. And this friend of hers at school said this boy didn't like her and never did.
That type of history does happen, especially when I first entered into the hospital, because when we're first taught it, we're taught to be very thorough. And so when you go into hospital and I have unlimited time because I've been recommended to see a patient and I speak to that patient, I would speak for a really long time and ask them, very in depth, sort of like what happened there. But as I've seen more doctors work, you kind of learn a bit about which questions are important and learning when to ask enough questions, which is something I'm still struggling with at the moment.
You have decreased reflexes in your patellar tendon. Anyone?
Slip disc?
Decreased reflexes can be caused by a nerve problem. So you're not reacting as much. So a slip disc could cause that. Hypothyroidism can actually also cause that because it slows everything down. Other causes... like strokes or that affect your brain would cause increased reflexes. And apart from that, it could also just be normal in terms of like within normal, it'd still be acceptable. It's not reduced to the point that you would worry about it. But other causes, I think loss of sensation could also cause reduced reflexes too.
How bad does it hurt?
It hurts really, really bad.
Yeah.
Okay, I think this lady is likely the one that's trying to achieve medications. That seemed a bit of a weird response.
The hell is wrong with me? Do something!
I'm also not too sure about this. I'm not sure what happened firstly, why they switched from, is this another representation of the golfer? But in this case, he also seems to be in an absurd amount of pain, which when I think about it, when he said one patient was seeking medications, this may be him. And one way to test this is sometimes doctors walk away and then you kind of see the patient calm down more and they're kind of looking to see if health professionals are there to then display their pain. But if he's in very severe pain, it's also important to take him seriously. So it's important to speak to him, I think, and see whether he is really eager for pain medications or whether there is something worse going on.
What do I do?
We can't diagnose him while he screams.
Better than killing him with painkillers that...
That was quite odd. And also, I'm not sure how long it takes for that medication to take effect, but quite odd. That was a pretty fun class to sit in on. Our classes aren't usually like that. They're either teaching us about a specific condition, or in small groups, we go to see patients and examine and speak to them and then discuss the case afterwards. But I think this would be a pretty cool style of teaching where you have 3 patients with pretty similarly presenting problems, and then you kind of follow along and see how much they can differ. Thank you guys for tuning into today's video. I hope you've enjoyed it and found it helpful. I had a bit of fun recording it as well. I quite like the show. I see it a lot on Facebook, and some people may find House disagreeable, but I find him very entertaining. And also the show was pretty good from a medical perspective as well. If you have any questions, drop them in the comments below. Otherwise, enjoy your weeks, and I look forward to seeing you all next time.